Hello friends, myself Dr. RUCHIKA, Associate Professor and a Gynecologist. Today I will be telling you whether sex is safe during pregnancy. First of all, I would like to say please do subscribe to this channel, and if you like this video, put a like so that I get motivated, and also share these videos with your friends for all such authentic information. So I would say yes, it is safe to have sex during pregnancy provided your doctor has given you certain contraindications. Women themselves have certain body disfigurement during pregnancy, and they feel that they are not beautiful, but it is not so. It always promotes bonding between you and your parents, and it is not just about penetrative sex, it's also about foreplay and loving and kidding. And so there are certain conditions in which sex should be avoided, like if you have a history of repeated miscarriages, repeated abortions in the previous pregnancy, or if you have a cervical stitch placed in you, history of cervical encerclage. This cervical stitch is given when your cervix is short and its mouth is open, it is slightly dilated. So this cerclage stitches are given in patients with painless dilatation of cervix, where the cervix gave its way, leading to repeated miscarriages. Then if you have a history of preterm labor, that is, if you have a history of preterm delivery before 37 weeks of pregnancy, or if you have leaking or your water has already given way, or if you have a history of bleeding per vaginum, or spotting or passage of brownish discharge per vaginum, or passage of your water has given its way. Also, in certain condition called placenta previa, where the placenta is implanted into the lower uterine segment, there sex is not safe because there is a theoretical possibility of causing further bleeding and causing risk to the patient, but practically it has not been found. But on a safer side, we advise you that sex should not be done. Also, if you have vaginal infections, or if your this partner has sexually transmitted diseases, you should not try to avoid sex, or if you do, it should be with a condom, unless your infection has treated, because the infection can go upwards, causing PID and other and it will ultimately cause preterm labor or premature pains, that is your premature uterine activity. Sex has already told you, it has certain advantages also. It releases endorphins, so your mood is elevated, you get better sleep, you feel more satisfied because certain hormones, others are also released. The nipple, which is stimulated, it releases oxytocin, which is a bonding and love hormone, and the oxytocin also causes uterine activity, that is, it stimulates the uterus to cause certain contractions. Likewise, when the prostaglandins from the semen are released into the vagina, they can cause uterine contractions, and they can also cause the ripening of the cervix, that is, the cervix will loose up and cervix may begin to dilate and give way, leading to initiation of the labor pains. Also, cervical prostaglandins are also released if the cervix is stimulated, and oxytocin because of nipple, I have already told. So in certain studies, it is also being found that sex can also stimulate labor. So in early pregnancy and in late pregnancy, some people may hesitate to do sex, but in the middle period, it is very absolutely safe to do sex. But you should try that husband is not too overweight and he is not putting all of your weight over you, and you should preferably, if it's possible, remain in the side position, so that and you should explore your body, and because it is said that when you lie supine or straight on the bed, there is possibility that the uterus, growing uterus, it will press over your veins and your blood pressure may fall. So as long as it is not thrusting experience, sex is absolutely safe during pregnancy. And one question people ask, that when we can assume sex after delivery. So after 15 days, some people can resume, but it is perfectly okay to resume sex after 6 weeks or 1.5 months of delivery, because by that time most of the changes which had happened during the pregnancy they have almost reverted to normal. Your stitches are now healthy, and your cesarean stitches, they are also not aching, and the episiotomy and the lower stitches which were given, they are also okay. So take care. If you like this video, put a like. Bye bye, take care.